Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Vaccination campaign starts in Nigeria with frontline health workers first in line. More states declare their level of readiness to store and roll out vaccines. And Australia asked the European Commission to review Italy's decision to block the export of 250,000 doses of AstraZeneca to the country. First, let's bring you up to speed on the number of coronavirus cases in the country, even as inoculation of the Oxford AstraZeneca vaccines begin today in Nigeria. The Nigeria Center for Disease Control, NCDC, announced 709 new confirmed cases and 12 deaths recorded in the country. The new cases are reported from 21 states, with a surprise lead of Adamawa State registering 180 cases, while Lagos is in second place with 141. Next is Ondo, which registered 60 cases, Anambra 54, Rivers 41, Taraba 33, Edo State recorded 30 cases, 22 were recorded in Abia, another 22 in Kaduna State. The FCT recorded 21 cases, Akwa Ibom 20. Kano as well recorded 20 cases, Plateau 11, Ekiti 10 also in Kebbi and Nasarawa, while 7 were recorded in Bayelsa, 5 each in Ogun, Osun, Oyo, and 1 case in Gombe State. This is a big turnaround from the figures of previous days, which have been relatively low. The last time Nigeria recorded something close to this number was on the 24th of February, when the NCDC registered 655 cases and the death toll figures was at 1,885. But till date, the death toll stands at 1,951, with recoveries totaling 136,335, while close to 150,000 have been confirmed in the 36 states and the Federal Capital Territory. Today, frontline healthcare workers in the nation's capital have become the first to be given shots of the Oxford AstraZeneca COVID-19 vaccines in Nigeria. Cyprian Ngon, a medical doctor at the National Hospital Abuja, who has been on the front line since Nigeria's first case of COVID-19, became the first to receive the vaccination in the country. It was administered by the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib. Now, 3 other healthcare workers received the vaccination, including a nurse. The vaccination exercise was rolled out 3 days after the federal government took delivery of almost 4 million AstraZeneca COVID-19 vaccines under the COVAX initiative. Now, according to the National Primary Healthcare Boss, an improved number of 50% of Nigerians have indicated interest and willingness to be vaccinated, while 25% remain skeptical. He insists that the vaccines will not be deployed to any state that has not fulfilled its preparedness criteria. Now, while Nigeria becomes the 3rd country in Africa after Ghana and Côte d'Ivoire to roll out the vaccine from the COVAX facility, both the Secretary to the Government of the Federation and the Speaker, House of Representatives, are appealing to health officials to ensure that every eligible citizen is vaccinated.
Line health workers in the first batch of vaccines received, they have fought hard to save us. They laid down their lives for us, and in the ICUs and treatment centers, they became our last line of defense. On behalf of the President of the Federal Republic of Nigeria, the government and the people of Nigeria, I salute our heroic frontline medical personnel for their professionalism and commitment to saving lives.
The next prioritized group are those who, if they become infected, are at higher risk of severe disease. These are the elderly and the vulnerable, as defined by presenting with pre-existing conditions like obesity, diabetes, chronic kidney, respiratory, and heart disease, and cardiovascular diseases and other medical conditions as identified by their doctors.
We took all of the measures that were required, more measures than many countries took when it came to selecting the vaccines for Nigerians. Yes, there was a lot of talk about the delay. Yes, there's a lot of talk about why we're not starting when other countries were starting. But we realized that it is more important that we got WHO emergency use listing, that we also looked at some of the more stringent regulatory agencies before we finally asked NAFDAC to assess the vaccines. They've done all of their work, and I want to put it on record again that the vaccines that we're going to be delivering today to Nigerians are safe, they're effective, and we're going to roll out this vaccine in a very efficient manner, just like we all work together as one country and defeated the wild polio viruses.
Now to Edo State, where the governor, Mr. Godwin Obaseki, has warned against disregarding preventive protocols. He insists that vaccination alone will not make the coronavirus go away immediately. He also assures residents that he will take his own COVID-19 vaccination, noting that this will clear doubts from those who are concerned over the safety of the vaccines. Well, several other states are also gearing up for the vaccines in the southwest. The Ogun State Governor, Dapo Abiodun, says the state is ready to begin the vaccination process. He made the comments at his office, where he further disclosed that his administration has received guidelines from the National Primary Healthcare Development Agency on those to be prioritized, while ensuring that all of its refrigerators are in good condition to store the vaccines.
We are fully prepared to receive the vaccines and actually commence vaccination. I don't know how much of that you know. The entire cold chain that is required to keep the vaccinations have been identified. In each of your wards, we have a refrigerator that is in good working condition to receive the vaccines. In every ward in the state. We actually have more refrigerators than the number of wards that we have. So we have those that are there right now, and we have the backups as well. So we are fully prepared. Pastor are going through a training program right now. There's the trainers program that's ongoing right now to ensure that everybody knows what to do. Very soon, the Ministry of Health will give you all the other details as to how this is going to roll out.
Well, let's bring you the Edo State Governor, who still insists that the preventive protocols are really important, even as vaccination has begun.
It will still be in place. Don't forget that it's going to take a while to vaccinate almost the 80% of the population which is required to drastically slow down the spread of the virus. So this virus is going to be with us for quite some time. The vaccine is just one of the first hurdles to reduce the spread of COVID-19. And the fact that you have taken your vaccine does not mean you should be careless, you should not wear your masks, you should not protect yourselves, because many more people may not have received their own vaccinations. So we will still continue to insist, advocate that people still conduct themselves and behave to prevent COVID from spreading, and also to just protect themselves from contracting the virus. I will take mine, and if I take mine and I'm okay, and that should give confidence to Edo people to take.
Well, Dr. Betta Edu, Cross River State Commissioner for Health, joins us right now on the program for more on the vaccination rollout. We'd like to thank you for joining us. If we remember correctly how the attitude or sentiments of Cross River at the beginning of the coronavirus pandemic, now the vaccines are coming in. What are those sentiments towards the vaccine?
Okay, thank you. We're happy that the vaccines are finally in the country, and we're happy that health workers can gain access to the vaccines. Of course, we have done our own homework in Cross River State, and we're ready to receive the vaccines as soon as they begin distributions to the state. Presently, trainings are ongoing at the state level and at the local government level for health workers. E-registration would be starting almost immediately, and we are believing that we can get all health workers registered online so they can be eligible for the vaccines. We hope to receive the vaccines next week in Cross River State, and we would be giving the vaccines to frontline health workers, including those in the military and paramilitary. We also would be giving some strategic leaders within the communities. We've been doing a lot of work around risk communication, letting our religious leaders, health workers, and others understand what the vaccines are about and how it can protect them. We've been fighting against so much misinformation, especially going on the online media and social media. A lot has to be done just to overcome this.
So even the Nigeria Governors Forum are insisting on the safety and efficacy of the vaccines. I mean, as a public health physician, are you in doubt as to the vaccines?
So I'm not in doubt as to the efficacy of the vaccines, even though the efficacy is not 100%, but I'm not in doubt as to the ability of the vaccines to reduce the mortality and morbidity associated with COVID-19. There's nothing that comes without a risk. So within the population, there could be 1 or 2 persons who would come down with adverse effects following immunization. However, that should not deter the public from taking up these vaccines. And you've heard from several quarters, it's important, even after taking the vaccines, to continue to use your face masks. Remember, the first dose doesn't give you as much immunity as you might need. And even after the 12 weeks, when the second dose would be administered, it doesn't still prevent you from transmitting. It can only prevent the virus from affecting you. So you need to be able to protect yourself and at least wear that mask to protect others in public places.
Finally, Dr. Adu, what is the quantity that your state is expecting, and is it sufficient for the 2 doses for each person?
So they're not giving vaccines for the 2 doses right now. It's just the vaccination for 1 dose. And like I said, they're prioritizing health workers and the strategic leaders within the state who will show that example to others that the vaccines are safe for taking. Right now, the final numbers that will be coming to Cross River has not been determined yet. And this is because we have just collected today the list from the military and the paramilitary, and we'll be sending that to Abuja, to the National Primary Healthcare Development Agency. That will form the total number that is supposed to come to our state. And of course, they have to factor in some more vaccines for strategic leaders. So we should be looking at a little, probably above 20,000 vaccines coming to Cross River State. Our cold chain systems are ready, and we're working with them to see that the logistics are perfected.
We'll continue to follow the developments. We appreciate your time on the program. Dr. Betta Edu, the Commissioner for Health, Cross River State. Thank you for joining us on the program.
Thank you very much for having me.
And in Yobe State, healthcare personnel are being trained on the vaccination process in collaboration with the government and the National Primary Healthcare Development Agency. The Secretary of the Primary Healthcare Development Agency in the state, Dr. Kundi Machina, says that while Yobe is expecting the vaccines, it is taking steps to educate healthcare workers on basic facts, storage system, risk communication, demand generation, and acceptance of the vaccines.
This is one of the steps through the National Primary Healthcare Development Agency to roll out this vaccination exercise. National TOT was conducted on Monday and Tuesday this week, and this is the state-level rollout training to our LGA leadership, the LGA Health Management Team, which comprise about 12 personnel from each of the local government areas. The national program has a plan to have a public enlightenment campaign across all levels. This is just a technical aspect where we train the healthcare workers, including how are they going to sensitize the people at the community as we begin the airing and the discussion with regard to the community dialogue, sensitization and co across the medias, be it electronic and print media.
Away from Nigeria, Germany's Chancellor Angela Merkel has unveiled a 5-step plan for easing the country's lockdown restrictions. However, the plans have been criticized for coming too early and for being too confusing. Meanwhile, the government has been accused of bungling the rollout of both vaccines and tests. Well, Daniel Winter, Deutsche Welle correspondent, joins us from Berlin for more updates. Hi, Daniel. Angela Merkel previously said she wanted to wait until infections were at much lower levels before easing lockdowns. Is this a U-turn from the German Chancellor?
Well, the Chancellor argues that the circumstances have changed enough to allow possible reopening. For example, the availability of rapid testing, which just wasn't there in Germany until recently. Well, now her government says there'll be enough tests to get every citizen a COVID result for free every week until the population is vaccinated. With 80 million people, that's quite a feat. However, the likes of the Association for Intensive Care Medicine says it's way too early to introduce a roadmap for reopening. Death rates may be going down, but daily cases are creeping up. Some opposition politicians, such as from the left party, say we should wait until the vaccination rate has increased. Though on the other side, the government's finance minister, who's from a different party than Angela Merkel, has criticised her plan for not reopening fast enough. We are in a general election year, though, so we can expect criticism from all sides. Speaking to people here, normal Germans, there's cautious approval, but also a bit of confusion over the plans. There are 5 steps, each with different criteria, and if those change, lockdowns could be reintroduced.
Seems like tough times for government officials this period, but it was a German company that came up with one of the first approved vaccines, yet Germany is still lagging way behind with vaccinations. Where did it all go wrong?
Well, it really has gone wrong. Only 5% of Germans have even received their first dose. Essentially, Germany bought into the EU's collective programme for sourcing vaccines, and to put it simply, the EU backed the wrong horse. AstraZeneca vaccine production inside the EU did not go to plan. And the situation was so bad that Germany's popular newspaper Bild wrote the headline, "Dear Britons, we envy you." After all, in Britain, they vaccinated almost a third of their population with that first dose already. And in Germany, it's a lot lower, that rate. While Germany is set to get a large batch of millions of doses this week, only 65% of those doses already in Germany have been administered so far, highlighting logistical or bureaucratic problems in the country.
So, Daniel, is there any sense of when Germany and Europe will begin to get back to relative normality?
Well, scientists say it's quite possible that case numbers will ease over the summer as they did last year, but Europe's biggest problem is the patchwork of strategies and lockdown measures of all kinds, which has the potential to cause further chaos. Just imagine for holiday makers or for business travellers, for example. If all goes to plan and the vaccine rollout speeds up, case numbers drop, well, Germany will be at a stage of new normal by around April. Museums, cinemas, restaurants will be open, though with strict hygiene measures still in place. What's likely is that Germany and Europe will get a lot more freedom during the summer, but whether that counts as back to normal depends on a multitude of factors. What Germany's response needs now, more than ever, is a shot in the arm, quite literally.
Good to see you again, Daniel. Thank you. Daniel Winter, Deutsche Welle correspondent there with the latest. Now, Australia has asked the European Commission to review Italy's decision to block the export of 250,000 doses of the AstraZeneca vaccine to the country. It is the first time new rules have been used that allow a ban on EU exports if the drug provider fails to meet its obligations to the bloc. We'll hear more on this and other developments on our global COVID-19 update.
Italy has been hit badly by the pandemic, and its decision to block vaccine exports to Australia has reportedly been backed by the European Commission. The country has registered more than 2.9 million cases and nearly 99,000 deaths. Australian Prime Minister Scott Morrison says while he had requested the review, he could also understand why Italy made the decision.
In Italy, people are dying at the rate of 300 a day. And so I can certainly understand the high level of anxiety that would exist in Italy and in many countries across Europe, as is regularly conveyed to me. And so they have some real difficulties there. They are in an unbridled crisis situation. That is not the situation in Australia.
Meanwhile, Germany's health minister says drug manufacturers must honour vaccine supply contracts to Europe. But Germany had not yet had any reason to stop shipments of shots produced domestically to other countries. And over in New Zealand, Prime Minister Jacinda Ardern says the government will on Sunday lift a lockdown in the country's largest city of Auckland, which was prompted by just one new case of the coronavirus. Ardern imposed a 7-day lockdown on the city of 2 million last Saturday, continuing its go hard, go early response throughout the coronavirus crisis. 2 more locally transmitted cases were subsequently reported, but no new cases have been reported in the last 5 days. And finally, students in England preparing to head back to school next week are undergoing COVID-19 tests across the country.
I'm a lot more confident as I know that people that have tested positive won't come in, and that will make it a lot more safe environment at school and allow the school to stay open. And I don't think anyone wants to go back to homeschool.
I think the test process is going to be effective, so I'm quite confident in the school, our school's capability to make sure that all of our students are back in school and just get back learning.
The Prime Minister confirmed last week that all schools in England are going back from the 8th of March, with schools able to decide a phased return during that week.
Let's all continue to take responsibility. If you have symptoms associated with COVID-19, then please visit one of the sample collection sites in your state to get tested. Visit our website for more updates and a better understanding of the pandemic. You can see our top story there, that no one is safe until everyone is vaccinated, coming from the chairman of the PTF. You can find several other stories at our website, channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Mwoga. Stay safe.